Hi, I'm Dr. Steve Myers, and I'm here with my patient Robert, who is 3 months out from a bilateral knee stem cell procedure for bilateral knee arthritis. Before we talk to him, we're going to take a quick look at his x-rays. Okay, so taking a look at his knees. This is a standing x-ray of both knees. This is his right knee, and this is his left knee. Taking a look at his right knee, you can see a good amount of joint space. This dark space is the cartilage thickness on the outside of the joint. He should have the same amount of space on the inside of the joint, and he has significant loss of space. We call that arthritis, loss of cartilage, and he also has some bone spurring on the inside of the knee. Looking at his left knee, he has significant loss of joint space, almost complete collapse of the joint space, severe arthritis, severe cartilage loss with bone spurs on the inside of the knee. Okay, so thinking back to before your stem cell procedure, what kind of issues were you having with your knees? Describe the pain symptoms and issues you were having in your knees.
Both of my knees from the arthritis hurt daily, all the time. The only time they didn't hurt was when full rest in the bed if I wasn't moving. Other than that, anytime I was up, my knees hurt all the time.
What activities were especially difficult for you?
Getting up from a chair, a seated position in a chair, working in the garden, walking the dog, almost anything I did where I was up and about, my knees hurt.
And before your stem cell treatment, what other treatments had you tried before stem cells?
Well, I hadn't tried any. I mean, I've had arthroscopic surgery done on both my knees before for bone spurs.
And how ultimately did you decide to do stem cell for your treatment option?
I did some research online to check on it, and then once consulting with you, I decided that's what I wanted to do. I wanted to give it a try.
So here we are, 3 months down the road from stem cell. How are you doing?
I'm doing great. My knees feel 95 to 100% better than they did before.
Are there activities that you can do now that were impossible or difficult before?
They were difficult before. Now I can do anything I want to do outside. I can get down on my hands and knees in the garden, and when I get up, my knees don't hurt. They don't hurt when I'm going to get in a seated position and get up, my knees don't hurt. If I'm walking the dog, my knees don't hurt.
Fantastic. So, having been through it now 3 months down the road, do you feel like you made the right decision with your treatment?
I certainly do. I certainly do.
Fantastic. Well, thanks so much for coming in and sharing your story.
You're welcome, Doctor.